words are all I have to take your heart away.
In this lecture, we will study terms that describe body position and the relative position of our organs. Most of our internal organs, known as viscera, are located within two large cavities. The large cavity in front is called the ventral cavity. The smaller cavity in back is called the dorsal cavity. The dorsal cavity houses the central nervous system and is subdivided into two smaller cavities. The cranial cavity contains our brain, and the vertebral cavity contains our spinal cord. The ventral cavity is subdivided into two smaller regions by a muscle called the diaphragm. Diaphragm is from a Greek word that means partition. The yellow cavity above the diaphragm is called the thorax, which is Greek for chest. The thoracic cavity houses our heart and lungs. Below the diaphragm is the abdominopelvic cavity, shown in red, where the bulk of our digestive organs are located. There is no diaphragm separating the abdominal cavity from the pelvic cavity. Instead, the pelvic cavity occupies the bowl created by the hip bones and houses our bladder and reproductive organs. The abdominal pelvic cavity is such a large region with many viscera that anatomists have subdivided the cavity into 9 smaller regions to allow more precise communication. The 9 regions are created by drawing 2 vertical and 2 horizontal lines. The horizontal lines are drawn at the base of the rib cage and at the top of the hip bones. The 2 vertical lines are drawn just medial to the nipples. Each region is named. The center square is called the umbilical region because it contains the umbilicus, which in daily language is known as the belly button or navel. Lateral to the umbilical region are the 2 lumbar regions. Above the umbilical region is the epigastric region, which means over the stomach. Lateral to the epigastric region are the 2 hypochondriac regions. The term hypochondriac means beneath the cartilage of the rib cage. Chondros is the Greek name for cartilage. Below the umbilical region is the hypogastric region, which means below the stomach. Lateral to the hypogastric region are the 2 iliac regions, named after the hip bones. Describing a patient's pain or injury using the 9 regions is more useful than saying merely the abdominal pelvic cavity. The former greatly reduces the diagnostic options. Some organs are located almost entirely in one region. Most of the small intestine, for example, is located in the umbilical region. The spleen is within the left hypochondriac region. The bladder, rectum, and uterus are within the hypogastric region. However, many organs span multiple regions. The liver spans the epigastric and right hypochondriac regions. Sections of the large intestine can be found in all 9 regions. A simpler means of subdividing the abdominal pelvic cavity uses only two lines, one vertical and one horizontal, that cross at the umbilicus. This produces four regions called quadrants. The quadrants are labeled right upper quadrant, RUQ, left upper quadrant, LUQ, right lower quadrant, RLQ, and left lower quadrant, LLQ. The quadrant approach makes it simpler to communicate the location of some organs, like the liver and the kidneys, which now are largely within one quadrant. However, the rectum, bladder, and uterus are split in half by the quadrant boundaries. Whether you choose to use the 9 regions or the quadrants to describe the location of an organ will depend on how much of the organ is found within one of these categories. If you were describing the location of the bladder or the spleen, you would use the 9 regions. If you were describing the location of the liver or the left kidney, you would use the quadrant system. Do you see a problem with the image on the right? The horizontal and vertical lines do not cross at the umbilicus. You can't believe everything you see on the internet. Ambiguity can be frustrating in daily life and costly in medicine. Did you ever receive a parking sticker that instructed you to place it on the right side of the front window? As you prepare to apply the sticker, it dawns on you that the right side differs by whether you're sitting in the car or facing the car from the front. Which perspective do you use? A mistake placing a parking pass on the wrong side of your window may cost you a fine, but a mistake in the operating room will be far more costly.
I'm sorry, so sorry that I was such a fool. You tell me mistakes are part of being young, but I don't that's been done.
It's essential to avoid ambiguity when we speak about the body in a medical setting. To avoid ambiguity, we need some standard for talking about the body and the relative location of organs that is independent of the position of a person at the moment. For example, the heart is above the diaphragm in the image on the left. But if this person were hanging by their toes from the chandeliers, their heart is below the diaphragm. If they were lying on their side, the heart would be beside the diaphragm. If an EMT reports that the heart of an accident victim is below their diaphragm, we do not want to speculate whether the patient is upside down in their car or if their heart has been shoved below their diaphragm by a deadly wreck. We need an agreement, a coordinate system, to speak about the body to avoid ambiguity in these situations. To prevent ambiguity, we define the anatomic position. The person about whom we are speaking is assumed to be standing upright, facing forward, arms at their side, with palms facing forward. Right and left are from the perspective of the person about whom we are speaking, not the observer. As a consequence, The heart will always be above the diaphragm, regardless of the actual position of the patient, unless there's been a terrible accident and the heart has been fatally dislocated. The patient's right hand will always be the same, whether we're observing the patient from the back or the front. With reference to the anatomic position, let's explore the technical terms used to describe the location and relative position of organs within the body. Most of these terms come in pairs. For where there's an up, there's a down. Where there's a right, there's a left. Our first pair of terms is anterior, posterior. Anterior means in front of, posterior means in back of. The eyes are anterior to the brain, or the brain is posterior to the eyes. The sternum is anterior to the heart, or the heart is posterior to the sternum. Ventral and dorsal can be used as synonyms for anterior and posterior. If you learn the muscles and bones on one side of the body, you will be rewarded with knowledge of the muscles and bones on the other side at no extra charge. We call this bilateral symmetry. What happens to an organ on one side of the body may or may not happen to its mate on the other side. If a condition affects only one side of the body, we call it unilateral. If it affects both sides, we call it bilateral. A unilateral orchiectomy means one testicle is removed. A bilateral orchiectomy means both testes are removed. This woman is standing in the anatomic position. You won't see many patients standing in this position, nor should you ask them to. You need to become comfortable visualizing your patients in the anatomic position without demanding they stand to attention. And under no circumstances should you turn your back on your patients in order to talk about the relative position of their organs. This can be unsafe, and it can damage your patient's confidence in you. While we're visualizing our patient in the anatomic position, let's pretend there is a line drawn down the center of their body, dividing their body into right and left halves. We can then use the terms medial and lateral to describe the relative position of organs to this imaginary line. We can say the nose is medial to the eyes, or the eyes are lateral to the nose. We can say the heart is medial to the lungs, or the lungs are lateral to the heart. We can say the stomach is medial to the spleen, or the spleen is lateral to the stomach. This means the spleen is farther from the midline than the stomach. We can draw an imaginary line down the center of your hand and say that your thumb is lateral to your index finger, or that your index finger is medial to your thumb. Ipsilateral means on the same side. Contralateral means on the opposite side. Your right eye is ipsilateral to your right kidney. Your right kidney is contralateral to your left kidney. Distal and proximal are used to express the relations of body parts along an extremity. Proximal means nearer to the trunk. Distal means farther from the trunk. Your hand is distal to your elbow, or your elbow is proximal to your hand. Your knee is distal to your hip. Your hip is proximal to your knee. We can also apply proximal and distal to tubes inside the body. In this context, proximal means nearer to the beginning of the tube. Distal means nearer to the end of the tube. Applying this to the digestive tract, we can say that the esophagus is proximal to the stomach, or the stomach is distal to the esophagus. The small intestine is proximal to the large intestine, or the large intestine is distal to the small intestine. We can say the mouth is the proximal end of the digestive tract, and the anus is the distal end. Did you notice the British spellings of esophagus and cecum? The terms superior and inferior in anatomy and medicine have nothing to do with good or bad. Instead, they mean above and below. The lungs are superior to the diaphragm. The diaphragm is inferior to the lungs. The nasal cavity is superior to the oral cavity, or the oral cavity is inferior to the nasal cavity. Cranial refers to the head, and caudal refers to the tail. Some sources substitute cephalic for cranial. Cephalic actually refers to the brain, but since most of us keep our brains in our heads, we can use the two terms interchangeably. Humans don't have much of a tail, so for humans, caudal refers to the lower portion of the body. Cranial means nearer to the head, whereas caudal means farther from the head. The urinary bladder is caudal to the liver, or the liver is cranial to the bladder. Superficial means nearer to the surface, whereas deep means farther below the surface. You're viewing a cross-section of the skin. The superficial outer layer is called the epidermis. The deeper layer is called the dermis. We say that the epidermis is superficial to the dermis, or the dermis is deep to the epidermis. A paper cut is an example of a superficial wound, whereas a cut more than a quarter inch below the surface would be called a deep wound. In biology and medicine, there are names for everything, usually several names, in fact. And that includes names for body position. For example, if you are lying down, no matter what position you're in, we say you're in the recumbent position. If you're lying on your belly, you're in the prone position. If you're lying on your back, you're in the supine position. Think of supine rhyming with spine. If you're on your side, you're in the lateral position. The Fowler position has you in the supine position, but your head is elevated and your knees may be flexed. The Fowler position is recommended for people who have difficulty breathing when they try to sleep. The Sims position has you in the left lateral position, with your right hip and knee flexed. This position is used for rectal exams and to administer enemas. The lithotomy position has you on your back with your knees elevated and thighs abducted. This position can be used to deliver a baby or for gynecological or urinary exams. The name lithotomy literally means to cut stones. Lithos is a Greek term for stones. The lithotomy position was named for its use to remove stones from the urinary bladder. Let's say you were cast as the villain in the 10th remake of the Texas Chainsaw Massacre. The script says you're supposed to use your chainsaw to slice the clueless screaming co-ed in half. But as you prepare to make your cut, you realize the script didn't specify whether you were to cut her in right and left halves, or top and bottom halves, or front and back halves. Fortunately, in medicine, there are specific terms covering all these dissections and more. Cutting the body the long way is called a longitudinal section. If you cut the body into left and right halves, we call it a sagittal section. If you cut down the midline, it is a mid-sagittal section. If you cut to the left or the right of the midline, it's a parasagittal section. Cutting the body into front and back halves is known as either a coronal or frontal section. Cutting the short way across the body is not called a shortitudinal section, so don't call it that. But we do have three terms you can use. You can say it's a horizontal section, or cross-section, or transverse section. Why have one term when three will work just as well? Of course, if you are particular, you would also need to specify at what level the section is to be made. Finally, you may want to cut the body or one of its parts at an angle. This kind of section is known as an oblique section. Oblique is from a Latin word that means at an angle. Here we're demonstrating all three sections using the large intestine. Cutting the short way across is called a transverse section, or cross-section, or horizontal section. Cutting the long way is an example of a longitudinal section. Cutting at an angle is an oblique section. Before the 20th century, physicians needed to cut open their patients to see inside their body. The procedure was called exploratory surgery. The discovery of X-rays in 1895 led to the rise of medical radiology and the use of X-rays to peer inside the body without surgery. Simple X-rays, known as radiographs, were especially useful in imaging hard structures like bones and teeth. A downside of X-rays is that they can injure tissues and cause cancer. In the 1950s, ultrasonography was introduced to explore the inner space from outside the body. Ultrasonography uses high-frequency sound waves that we cannot hear to image internal structures. These sound waves are harmless and so are especially appropriate for imaging a fetus in utero. The image produced is called an ultrasonogram, or simply a sonogram. In the 1970s, the X-ray machine was married to the computer to produce a CT scan, or CAT scan, that permitted imaging of internal organs in 3 dimensions. There remained the issue of the damaging effects of X-rays, however. The 1970s also saw the marriage of the computer to powerful magnets that could briefly flip the alignment of water molecules inside the body to create an image. The MRI was born, magnetic resonance imaging. The MRI permitted imaging the body without the risk associated with X-rays, as long as you remember to remove the coins from your pocket. The development of these and other imaging techniques, such as PET scans and endoscopy, have rendered exploratory surgery nearly as extinct as the dinosaurs.